8. Acupuncture needling protocol.
This is a demonstration of clean needle technique in terms of application of acupuncture. And what I have here is an alcohol swab, and I have a sterile disposable needle. In just a moment I'll be demonstrating this technique, but as a prelude to this, what I want to indicate is that I have already established a sterile field in which I have placed an alcohol swab that is ready for use and a sterile disposable needle that is ready for use. I have washed my hands. I have put on sterile gloves because I'm demonstrating this as if I was working with a high-risk patient. I might be working, for example, in a drug treatment center. I might be working at a clinic treating HIV patients. I might be working with someone who has, say, hepatitis C. So I have the gloves on as if I was working with a high-risk patient. I have already washed my hands. I have already prepared my sterile field in which I have all of the equipment that I need. I have my alcohol swabs, my needle, my sharps container into which I can put the items that I've used and dispose of them properly. So as part of the procedure, what I will be doing is I will be taking the alcohol swab, which I've already opened, this other package, and I will be taking it and I will simply be lightly rubbing across the area that I am going to needle. And I will do this one direction once on one side. If I felt that I had to do it again, I would flip it over and I would use the other side. I don't see where that is necessary. So simply wiping it across in one direction. Now the alcohol does not in any way provide any sterilization. In fact, it doesn't do much of anything, but it is part of standard procedure. If anything, I guess it could be considered simply cleaning the area of any kind of debris that might be there, but in terms of microorganisms, it doesn't have much of an effect. I've already opened this package and had it in my sterile field, had it ready for use. This one here is sealed. Simply by peeling back the paper, I have it ready to use. There's a little plastic paddle. I'm not sure if that will show up or not, but I'm removing that. That's the actual piece that locks the needle, or locks the needle in the guide tube. And you'll see the guide tube here in a second as I remove the needle and the guide tube from its packaging. And now I'm ready to actually go to the location that I'm going to needle, place the guide tube there like so, and simply tap the needle in. And just that quickly, the needle has been inserted. Now I can remove the guide tube, and I am using sterile gloves here so I can support the needle, and I can begin to gently tap and tap and tap and tap. And this is helping to insert the needle as I just gently tap it in place. Like so. Now I have a needle inserted, and so that's how to properly insert the needle. Now the next step to this process, and there are several steps to this. Obviously there was the preparation of the sterile field, where I organized all of my materials to be able to needle my patient. Then there is the actual insertion of the needle itself, and finally there is the manipulation of the needle. And manipulation of the needle can involve further tapping of the needle. It can involve twisting of the needle. I can twist and I can apply a little bit of pressure to the needle, further inserting it deeper. And now I'm ready to allow the needle to remain in place until I achieve a clinical response in the patient in the area of treatment. The final stage in this process will be the actual removal of the needle and disposing of the needle itself. Here once again we have the needle inserted, and to further manipulate the needle or demonstrate that, just tapping of the needle. Let me use the other hand so you can see that. Just tapping with the needle like so. I'm just doing this kind of lightly here, or twisting of the needle. Try it with the other hand so you can see it better. And a little bit of pressure sometimes if I do want it to be inserted a little deeper. Sometimes you will see the needle kind of bind a little bit. It will resist the twisting, and that's when it's hit the fascial plane in the connective tissue, and it's kind of like a fork in spaghetti, twirling around and winding. It has that connective tissue, and so it kind of grabs a hold of that, and sometimes the needle will resist turning. It will resist coming out. Sometimes you actually see the needle, as you say, in this case I'm winding it clockwise, you'll actually see the needle wind back around counterclockwise because I wound up some of that connective tissue fiber in there and it's moving back in the other direction. But that is needle manipulation. Now we're going to take a look at removing the needle. And I like my needle insertion to be as painless as possible. I'm happy when patients tell me they didn't feel a thing. Other than the needle stimulation itself, which is called dachi, that can be kind of a dull, aching sensation, which does not always occur, but is an effect that we achieve in the neurological system of the body sometimes. Sometimes we don't achieve that. It doesn't mean that the acupuncture is not working if you don't get that aching sensation. But when I remove the needle, and this is going to happen quickly, so you want to keep your eye on this, that is the needle removal right there. Just a quick out, just like so. When I come over to the sharps container, okay, when I come over here, like this, I come in horizontally to the container until I am directly over the hole in the container. Then I simply drop the needle inside the container like that. The reason that I don't simply come down vertically is that I might miss the hole, I might bend the needle, and it might stick me. So you come carefully from the side, come directly over the hole, simply tilt it and drop the needle inside the sharps container. Close the sharps container and then place the sharps container somewhere where people cannot, get into it easily, your patients, but particularly your patients' children. So place this away somewhere where if you have your next patient comes in with a child, that child cannot go and find this very bright, attractive object and dump all the needles out and play with them on the floor. That actually has occurred in some offices, not in my office, but it has occurred. And so it's something that you want to avoid by placing this somewhere where it is safe.